I'm a cardiologist. We use this platform to discuss things regarding our heart, health, and prevention. The reason that this is important is that we need to know this because if we can treat it appropriately, if we can treat it quickly, we can potentially prevent a heart attack from happening. So, using this platform to help people answer any questions that you guys may have regarding the heart, health, and prevention. All right, this is going to be a brief discussion about palpitations and why it's important. So, what exactly are palpitations? These are abnormal sensations that you feel in your body, in your heart. Sometimes you can have palpitations without any true rhythm to explain it. Sometimes you can have palpitations that has a rhythm to explain it, a reason for it, such as a PAC, premature atrial contraction, PVC, premature ventricular contraction. But those are just the smaller ones. You can have a lot of different things like atrial flutter, atrial fibrillation, even ventricular tachycardia, ventricular fibrillation are causes of potential palpitations. Some of them can be more deadly, some of them can be more dangerous and needs to be treated urgently. The latter ones, the ventricular fibrillation and ventricular tachycardia, they need to be treated with a defibrillation, shocking the heart. Those abnormal rhythms are not producing any significant flow to the heart. They're not producing any significant adequate blood flow. So those individuals need to be shocked. The other versions, the atrial fibrillation, atrial flutter, sometimes they need to be shocked. Sometimes they can be treated with medical therapies, with medications, and then following up with cardiologists for further treatments on ways that we can prevent this from happening, but also ways that we can potentially treat this for um, um, to cure it, to get rid of it permanently or to the best of our ability. Sometimes it may not be 100%, but 90 to 95, 95 to 99% rate of it not coming back. So, how do we evaluate someone who's having palpitations? First one is going to be an EKG. When they come to the office to see me, I'm going to get them an EKG and electrocardiogram to see what your rhythm is doing now. A lot of times, these rhythms, even though you're having them, these sensations you're having, you can not present with it in the office. You can present with a normal EKG that gives a false um, information for us because we think everything is all right. So if we have concerns, if we have more questions, we will ask for a longer monitor. And it could be as long as 24 hours or as short as 24 hours, and then move upwards to about 30 days. If we have really heightened sense of concern, we may even order a loop recorder, which can live for about, which has a good battery life for over 3 years, typically reserving those for individuals who have had dangerous heart rhythms that we have had complications of potential dangerous heart rhythms, such as atrial fibrillation. Those people can have strokes. So if someone has had a stroke and we have high concern that it may have been due to atrial fibrillation that we haven't caught with a 24 2 week month monitor, then we may utilize a loop um, device to further investigate for the long period of time because with atrial fibrillation, if untreated, can lead to strokes and recurrent strokes. Those risk factors are heightened in individuals who have hypertension, congestive heart failure, age greater than 65, and more concerning if you're 75, female, vascular disease, previous TIAs and strokes. If you have multiple risk factors, then increases the risk that you may need to be on a blood thinner to prevent that. Something like a warfarin or Coumadin, Eliquis or Pexaban, Xarelto or Rivaroxaban. So those are ways that we treat someone who has a significant specific palpitation known as atrial fibrillation. Now, um, other than medical therapies, like I said, some people can have palpitations due to crazy heart rhythms that may need an ablation. So an electrophysiologist would be the person who is responsible for this. They would do the procedure to get you out of this life-threatening rhythm. So just a summary, a palpitation is an abnormal sensation that you feel can be associated with significant abnormal rhythms that need more careful monitoring and possible treatment. Triggers for it includes things like caffeine, increased stress, not getting enough sleep. Treatment for it can be anything from nothing to ablation or even medical therapy. But a lot of times we start with removing the stressor, the risk, the trigger for this, whether it's excess caffeine, carbonated beverages, etc. My name is Dr. Isang. If you found any benefit in this, hit that subscribe button and leave a comment.